Imagine discovering your beloved goat with a painful, swollen lump on its face and no veterinarian available to help. The clock is ticking. That abscess could burst and spread infection at any moment. In this crucial guide, we'll walk through the emergency steps to safely drain and treat a facial abscess at home using basic supplies. But be warned, what you're about to see isn't for the faint of heart. Abscesses in goats are pus-filled infections that commonly occur when bacteria enters through small wounds or dental issues, spreading dangerous infection throughout the body. The key is acting quickly while maintaining sterile conditions to prevent contaminating your entire herd. Before beginning treatment, isolate the infected goat in a clean, dry area away from other animals. Gather all necessary supplies, including sterilized clippers for shaving the area, a fresh scalpel blade for incision, saline solution for flushing. Always wear disposable gloves and consider protective eyewear, as abscess material can squirt unexpectedly. Begin by carefully shaving the hair around the abscess to prevent contamination, making the procedure slightly less painful. Using a sterilized blade, make a small, controlled incision at the lowest point of the swelling to allow gravity-assisted drainage. This is completely normal, but requires careful handling to prevent spreading bacteria. After initial drainage, gently flush the cavity with room-temperature saline solution using a syringe, without needle, to remove all remaining debris. Follow with iodine solution to disinfect the wound, being careful not to use alcohol, which can damage tissue. The goal is to create a clean environment that allows healing from the inside out while preventing reinfection. Use non-stick gauze pads directly on the wound. Change the bandage daily, watching for signs of proper healing, like reduced swelling and pink. Administered subcutaneously for 5 consecutive days is the most accessible option for many owners. Calculate dosage carefully. Always pull back slightly on the plunger before injecting to ensure you haven't hit a blood vessel. Watch closely for danger signs, including persistent swelling, foul odor, discharge, lethargy, or loss of appetite. Any of these warrant immediate veterinary attention. Keep the goat isolated until fully healed to prevent spreading infection to herd mates. If the abscess keeps recurring, possible sign of CL disease. If the goat develops a fever over 103 degrees Fahrenheit, if the wound won't stop bleeding, or if the animal stops eating for more than 24 hours. The best treatment is always prevention. Implement regular health checks of your herd and quarantine new animals for 30 days. Proper nutrition boosts immune function, making goats less susceptible to infections. Consider establishing a relationship with a livestock veterinarian before emergencies occur. Treating abscesses is messy, stressful, but often necessary for responsible goat owners. Have you faced this challenging situation before? Share your experiences and tips in the comments below. For more essential livestock care guides and emergency treatment tutorials, subscribe and turn on notifications. Because when crisis strikes, knowledge is your most valuable tool.